Yeah. That's real.
All right, it's about noon, so we're going to go ahead and get started here. Can't hear me? Can you hear me now? Can you hear me now? Can you hear me now? All right, I'm going to talk louder too. So welcome everybody to our press conference commemorating Governor Cox's declaration of February 2023 as Maternal Mental Health Awareness Month. My name is Noah Materko. I'm the Government Relations Director for the American Heart Association, and I'm hosting this press conference in conjunction with the Utah YWCA, Voices for Utah Children, and in collaboration with the Mental Health Maternal Policy Committee. I would like to add that any Utah Department of Health and Human Services staff here today are here in an educational capacity and are not lobbying one way or another. The purpose of this press conference is to discuss significant statewide maternal mental health efforts, raise awareness, and promote destigmatization. If you're joining us on Zoom, we ask that you keep your sound on mute, and we'll do that for you, and keep your camera off. We also encourage you to add to the conversation in the chat box. We'll be taking questions at the end of the press conference, which we think will conclude around 12:35. Additionally, some of today's speakers will be available to media and the public to speak more afterwards. As you will hear, we have a lot of work to do to reduce disparities in mental health treatment and access for all women across Utah, and particularly for women of color. With supportive policies and strengthened system supports, we'll be equipped to provide families with the resources they need. We want to take a moment to recognize the legislative champions who have worked hard to create a lot of these policies and secure critical mental health funding. So if there are any legislators in the room, go ahead and raise your hand. I know we're expecting some more later. I see one of our speakers over here. So thank you, Representative Ward. And we'll have a couple more joining us in just a little bit. I will now pass it off to Bill Cosgrove to read the governor's declaration on maternal mental health, and then I'll introduce our speakers.
Thank you. I'm Dr. Bill Cosgrove. I'm a retired pediatrician, and I get the honor, the privilege of reading the declaration by Spencer Cox. This was requested by the Utah Maternal Mental Health Collaborative, and it's just kind of helps us to get the word out. Kind of put in perspective, we have another baby born in another 11 minutes, 47,000 this year. And each of them, luckily, has a mother, and we need to keep those mothers healthy, and we need to keep those infants healthy. So here's the declaration. Spencer Cox, Governor, declaration. Whereas Utah has one of the highest birth rates in the nation, whereas maternal mental health, which includes postpartum depression and pregnancy-related anxiety, continues to be a serious public health issue in Utah. Whereas maternal depression and anxiety encompass a range of symptoms and mental health disorders, including depression, anxiety, social withdrawal, and in extreme cases, psychosis. Whereas in 2021, more than half of Utah mothers report experience depression or anxiety during, for, or after pregnancy, and 1 in 6 mothers must contend with depression in the months after giving birth. Whereas 75% of Utah's maternal deaths in the years 2015 to 2016 were associated with current or prior mental health conditions, and 92% of those deaths were deemed preventable. Whereas Utah women of color disproportionately experience higher rates of postpartum depression from 2018 to 2021, 24.1% of Native Hawaiian Pacific Islander mothers, 18.4% of American Indian Alaska Native mothers, 23.1% of Black and African American mothers, compared to 15.1% of white non-Hispanic mothers. Whereas Hispanic Latina women had the highest percentage of maternal deaths among racial and ethnic minorities, 12.3% of maternal deaths from 2015 to 2019. Whereas maternal depression and anxiety are the leading complication of childbirth, with incidence rates higher than preterm births, higher than low birth weight babies, and higher than gestational diabetes. Whereas maternal depression and anxiety can affect a woman's ability to care for herself and to engage in healthy parenting behavior. Whereas if parents get help and treatment for maternal depression and anxiety, it can have positive impacts on their lives, including increased parent-child bonding, increased family stability, increased rates of breastfeeding, improved physical, behavioral, and developmental health and growth of their children, and safer home environments. And whereas there are evidence-based, cost-effective screening, detection, and treatment options to lessen the suffering of mothers, which may not be easily available to all mothers in Utah. Whereas the Utah Maternal Mental Health Referral Network is a resource for parents to find providers and support groups across the state and across all insurance and specialty types. Whereas screening, detection, support groups, therapy, and other treatments work for treating maternal mental health issues in pregnancy and postpartum. And whereas just speaking about maternal mental health reduces stigma and encourages help seeking for mothers and parents suffering alone. Now, therefore, I, Spencer Cox, Governor of the state of Utah, do hereby declare February 2023 as Utah Maternal Mental Health Awareness Month. Thank you.
Thank you very much, Dr. Cosgrove, and thank you to the Office of Governor Cox for recognizing this important issue. Our first speaker will be Representative Ray Ward. Sorry, Representative Lesser, he cut you in line. So come on up and we'll give you a couple minutes to talk about the issues we're. Thank you.
I just want to say thank you to all of you for being here to support this issue. I want to say thank you to the governor and his office for the work and attention that he's drawn to it. All of those things are helpful. When we think about an issue like maternal mental health, sometimes exactly what is needed is to drive directly at that one single thing. And in my mind, sometimes what is needed is to drive at a bigger objective that also winds up helping that thing. And I would say that helping maternal health also helps maternal mental health. And there's a couple of policies up here that are being talked about. I'll just mention a couple, and they'll get more mentioned specifically from some of the other sponsors today. There's a proposal up here to cover up till 12 months postpartum. Just on that 12 months coverage isn't only for mental health coverage. That's just for coverage on Medicaid, which does include the mental health. There's a proposal that talks about raising the multiplier of the poverty level for which we will cover women during their pregnancy. Right? Different states choose different multipliers. Some are at 135%, some are at 180%, some are at 200%, some are higher. Right now we're tied for last place. So we're not alone in last place, I guess, but we're sort of tied for last place with the lowest level of coverage amongst the states, and we can do better than that. And before all that coverage during pregnancy and after pregnancy comes whether or not you had coverage in order to be able to get contraception before you got pregnant. So a woman just can make her own choice about when is the right time to start her family. So to have that covered also would be helpful. Those are policies that if you're up here at the Capitol, I would invite you to seek out legislators and ask them to please support those ideas. Those ideas are being discussed and are by no means a foregone conclusion that they will pass. Legislators are thinking about it and making up their minds, and many are on the fence about it. So your input is so welcome. Thanks.
Thank you very much, Representative Ward. Our next speaker is Representative Rosemary Lesser of House District 10. Representative Lesser is a dedicated champion for Utah maternal and family health. Time is yours, Representative.
Shift this over a bit. Oh, this is the benefit of being short, that I'm probably the only one that shows up on the screen. Thank you, everyone, for being here today. You know, when maternal mental health has really been one of those conditions that has been kind of couched in shame and in disregard for its incredible importance. So often we congratulate new parents on their joyous new birth without recognizing that behind the scenes, there is suffering going on, and it is something that all of the people present in this room appreciate the importance of stressing this. The bill that I am sponsoring in this session addresses just one component, but one pivotal component to this, and that is actually decreasing the barriers to access care. There's opportunity, and I am grateful for the Department of Health and Human Services that has set up a national hotline for maternal mental health. But what happens when the individual talks with someone on this hotline who advises that care be rendered? If you don't have coverage, then we realize what an incredible barrier that is to accessing the resources that so many of you provide. So I hope for those of you who are on the Hill that you will share your passion for the mothers and individuals in the state who are struggling with maternal mental health. This is not just a woman's issue. This affects entire families, and it affects the bonding with the baby if the parents are struggling with health, and that has long-acting ramifications for health for the rest of their lives. So thank you all for the work that you do in this space, for calling to attention this very important issue. I applaud the governor for designating this month as Maternal Mental Health Month. And like all of these designations, this is not just limited to 1 month. Carry this with you every day. And let's hope that by gaining coverage in our state for people in need, that no longer will we have to just designate a month, but actually act on that. So thank you very much.
Thank you very much, Representative Lesser. Your tireless work on this issue has helped make Utah a better place for all people. Our next speaker is Representative Ashley Matthews, who represents House District 27. Representative Matthews is a tireless advocate for families in Utah and is sponsoring important legislation this session. Time is yours, Representative Matthews.
Yeah, I always hate to go after Rosemary because she is way better than I am at all of this stuff. So, but I'm grateful to have been asked to be here today to share with you about some of the work that I've done this year to address these very important family supporting issues. Using my own birthing experiences as a catalyst, I'm proud of the proposals that we've made to support birth workers and the mothers on 2 important pieces this legislative session. HB 415 will give mothers more options when selecting their preferred prenatal, postpartum, and birthing healthcare by expanding insurance coverage to include doula services, birthing centers, and midwives. Studies show that doula support during birth leads to lower instances of intervention while providing healthy birthing experiences. Mothers with birth workers have lower rates of maternal and infant health complications such as preterm birth, medical intervention birth, cesarean sections, and postpartum depression and anxiety. I was fortunate with each of my son's births to have wonderful, skilled, certified doulas there to support my husband and I and to help us to achieve the birthing experiences that we had hoped and planned for. And in each circumstance, having our doula in the room to both give each of us support and advocate for our birthing plan with healthcare providers was absolutely instrumental to our positive experiences. While we paid out of pocket for our doula services, the peace of mind was absolutely worth every single penny. Even though we're double covered with our employer-provided health insurance, neither insurance provider covered these services, nor the services of the birthing center that was our first choice as our preferred facility. Ultimately, we could not afford to pay the out-of-pocket expense for a birthing center birth, and were instead sent to a hospital for our low-risk intervention-free delivery. Birth workers services give parents a low-cost alternative that can also lead to lower medical costs for everyone else by taking the cost of giving birth from around $20,000 for a hospital setting birth to somewhere closer to $5,000 by removing expensive facility costs and additional and sometimes unnecessary charges for things like over-the-counter medications and hygiene products. Another way that we're working to support mothers and the providers of these crucial services is by our request for funding for the Comunidad Materna in Utah to purchase a vehicle for their mobile maternal visitation program and expand their services along urban and rural areas. Providing birth workers in rural areas may be the only option for some moms. 7 Utah counties are considered maternal healthcare deserts, with 0 OBGYN providers or hospitals providing OBGYN services. This maternal wellness bus will provide early pregnancy screenings, prenatal and postpartum education, and breastfeeding education to low-income, underinsured, and uninsured moms. I'm grateful to the advocates and providers that are helping to facilitate and push these discussions that allow us to create good policies that support healthy incomes for all of Utah's mothers and babies. Thank you for having me.
Thank you very much, Representative Matthews, for sharing your experience and your leadership on maternal mental health. Our next speaker is Carolina Barra, who works with Comunidad Materna in Utah, a nonprofit organization that provides doula services and helps expectant Hispanic mothers. Carolina, the time is yours.
Hello, everyone. My name is Carolina Barra. I'm program coordinator from Comunidad Materna in Utah. Our mission as a nonprofit is to empower expectant moms and their families to improve parenting experiences and provide self-advocacy during pregnancy, birth, and postpartum process. How can we do that? We have a wonderful team of birth workers who have been training as childbirth educators, birth and postpartum doulas, breastfeeding peer counselors, and community health workers. All this training have allowed us to serve our low-income families, underrepresented and uninsured communities. We provide prenatal classes to different maternity support groups, which are mental health and breastfeeding, home visits where our doulas assist the mothers with information about pregnancy, childbirth, and postpartum. Also, they give emotional support and breastfeeding assistance. This year, we have had the opportunity to work in rural areas supporting pregnant mothers with education and emotional support. Our goal is to develop a mobile maternal visitation program in rural and urban Utah. This project will allow us to reach participants who do not access to receive pregnancy confirmation in the first trimester, travel to rural areas to provide screening and informational support, and facilitate the relationship between community and medical system. Thank you.
Thank you very much, Carolina. Our next speaker is Lily Griego, Regional Director of the U.S. Department of Health and Human Services. I'll pass the time to you.
This is midge tricky as I brought my own laptop. I also am short, representative, so thank you so much for gathering here today. Let's see if I can hold this up without messing anyone up. I think I found it. There it is. Perfect. We're great. Thank you. So as mentioned, my name is Lily Griego. I'm with the United States Department of Health and Human Services. It's not common that a federal representative joins a conference like this, but this is one of the top priorities for the Biden-Harris administration. This is also a top priority for my jefe, U.S. Secretary Javier Becerra. So I come to represent him today, and I say thank you to the YWCA of Utah. I say thank you to the cohort of people, community members, representatives, senators who are taking a stance and leading the charge in this conversation. Just mentioning it, you heard it in the proclamation from your governor, who I also want to acknowledge. Just mentioning maternal health, mentioning maternal mental health will shed awareness and education on this conversation. So I want to acknowledge that. I also want to say the most important thing I can leave with you today is that every family, I'm not messing anything up, am I? The most important thing I can share is that every family in this country deserves to enjoy the experience of pregnancy, delivery, and the precious time after delivery. Thousands of women experience unexpected outcomes of labor and delivery that result in significant short and long-term consequences to their health, such as heart issues, the need for blood transfusions, eclampsia, and blood infections. Systematic barriers together with a failure to recognize, respect, and listen to patients of color has meant that Black, Indigenous, and rural women, regardless of income, regardless of education, experience a greater share of grave outcomes. Many mothers and families, pregnancy and childbirth, experience these traumatic experiences and take them on lacking dignity, respect, and all too often resulting in complications, mistreatment, and high medical bills. For far too long, we have allowed preventable deaths, and I want to really draw attention to this. The majority of these are preventable deaths for life-altering complications and untreated mental health and substance use disorders to persist. So I just want to draw attention that the administration has focused on this since day one. Not only did Vice President Harris hold the first ever event at the White House in April of 21, the president also drew attention to this as a top priority for the secretary on day one of entering the White House. But in addition to that, we've taken tangible actions and called upon our states and other folks in community to take action as well, as we've discussed here today. The Maternal Health Blueprint was issued last year. That is being implemented through CMS at HHS. And through that, we have had a series of actions, which I could spend 2 hours talking about all of this with you. So in short order, let me just establish a couple of things. CMS, the Centers for Medicare and Medicaid, established a birthing-friendly hospital designation, a publicly reported, public-facing hospital designation on the quality and safety of maternity care. Next, the department also announced more than 25 health plans, a PDF committed to displaying birthing-friendly hospital designations from providers will be also released, and that will go live, which means 150 million Americans in total will have the opportunity to make informed decisions about their birth care and their birth options. Also, I think touched upon today, the report for doula care and maternal health, an evidence-based review, was also released via HHS. In December, we had the omnibus. So I'm just going to bullet point 3 things that took place. Continuous eligibility, guaranteeing that every child in Medicaid, CHIP, approximately 40 million children, by the way, nationwide, will now have 12 months of continuous coverage. The extension of postpartum coverage, permanently extending a policy from the American Rescue Plan, allowing states to provide 12 months of postpartum coverage to pregnant individuals in Medicaid and CHIP. And also appropriations. Let me just touch briefly upon this to say the recent funding bill includes $324 million, an increase of $120 million for HRSA, CDC, and National Institutes of Health. Initiatives aimed at improving mental health and maternal health, reducing the nation's high maternal mortality rate. I think that I could go on, as I mentioned, but I'm just going to leave you with that the secretary noted from day one, the administration has prioritized maternal health, maternal mental health. Y si quiero decir algo para la gente que habla español, ¿cuándo podemos hacer algo? Ahora. ¿Qué podemos hacer? Haz algo. Do your legislation, pass the legislation, help Utah, ayuda a la gente aquí en Utah, por favor. Thank you so much for having me today.
Wow, that was amazing. Thank you so much for being here, Lily. This is incredible. I'm so grateful to be able to showcase not just what Utah's doing, but the United States as a whole is really rising to the occasion now to meet and address these needs head on. My name is Heather Dobb. I am here supporting, representing Postpartum Support International Utah. I'm the advocacy chair. And I also co-chair the Utah Maternal Mental Health Policy Committee with Gabe. And then I also do some federal legislation advocacy with an organization called Mom Congress. I'm a Utah delegate. We go to Washington, D.C. every year and meet with lawmakers to discuss federal legislation. So thank you so much for being here. Really quick, I'm going to introduce to you the blue dot. In just a few minutes, you will get one yourself. This blue dot is the national symbol for maternal mental health survivorship, support, and solidarity. The blue dot is featured on the logos of national maternal mental health support organizations, including the Blue Dot Project, 2020 Mom, and Postpartum Support International. In a moment, we'll hold a short moment of silence to recognize and honor moms and parents affected by maternal mental illness, both past and present. We invite you to hold your blue dot close to your heart to show your support. All participating via Zoom will find instructions to participate in the chat. But first, I'd like to invite our wonderful survivor mom, Kristen Arnold, to share her story with you.
Hi, I am Kristen Arnold. Oh, sorry. Can you guys hear me? Okay, I'll go ahead then. My name is Kristen Arnold. I am a mom of 3, and I am a survivor of perinatal mood and anxiety disorders, which I experienced around the birth of all 3 of my kids. Before my first child was born, I worked as a pediatric nurse, so I thought I was prepared for anything that could go wrong with my kid, but I was not prepared for the onslaught of symptoms of perinatal mood and anxiety disorder, which for me included symptoms of OCD, bipolar, depression, and anxiety. One thing I think is significant about my experience is that I reached out for help myself when I couldn't stop crying when my first child was 2 months old. I know that reaching out for help is really, really hard. That step alone is really, really hard for moms. And so it was discouraging to me when, despite reaching out for help to my midwife and trying to find a therapist and a nurse practitioner, I wasn't really able to get the help that I needed until I found an intensive outpatient program for moms that was able to help me. Through that program, I was able to get help from a psychiatrist and a therapist who had experience with perinatal mood and anxiety disorders. And I also was able to interact with other moms that were in a similar situation to me. Through that program, I was able to get on medications that helped me, and I was able to recover and get better. And eventually I weaned off of that medication. Then, during the pregnancy of my second child, I noticed again, because I was familiar with them now, those symptoms of a perinatal mood and anxiety disorder coming on. And I was able to start back up on medication with the help of my midwife at the end of my pregnancy. However, at the end of that pregnancy, after my child was born, I experienced the symptoms again, just hard and really fast. But fortunately, this time, I was able to get back on the medications that had helped me in the past, and I reached back again to that intensive outpatient program for moms and was able to do that and recover. After that, I continued to attend a free support group for moms with perinatal mood and anxiety disorders. And when my second child turned 1, I discovered that I was pregnant again, despite having an IUD at the time. This was a very stressful experience for me, but I really felt the support through that group. And I already had access to a psychiatrist who was able to help me adjust my medications and get back into a good place. That pregnancy was so hard, and the postpartum was hard too, because I had a baby who had to be in the NICU for a little bit. But I felt miles better than I did after my first child without the help. The help helped me feel stronger and able to get through those difficult things. My youngest is now 9 months old, and while I still struggle with symptoms from time to time, I'm so grateful for all the support that I have in place now. And I am so grateful and excited that we have this awareness of Maternal Mental Health Month, which brings view and attention to perinatal mood and anxiety disorders, because I think that moms, providers, caregivers, and family need to know what to look for, that symptoms can be different for everyone, where to look for help, and that they can get better. And just in closing, I just want to share a quote that Postpartum Support International always says, and that I love, And for any moms that are struggling right now, it is, you are not alone, you are not to blame, and with help, you will get better. Thank you.
Thank you so much, Kristen. We appreciate your vulnerability and willingness to share your powerful story. Now I ask you to please join me in recognizing a moment of silence. All survivor moms participating virtually, please turn on your cameras so we can recognize you. Thank you, everyone. Before I turn the time over to Gabe, I'm going to just briefly tell you about a few events we have coming up in Utah. Our sister organization, the Emily Effect, is hosting a Stand with Moms event on February 13th in Spanish Fort. This will be a public screening of I Am McKenna, a short film highlighting a Utah survivor mom story with maternal mental illness. Please visit emilyeffect.org to find out more information on this event. PSI Utah is hosting a broadcast of 2020 Moms Maternal Mental Health Forum, March 22nd through 24th. This is a 3-day event. It's open to all stakeholders in maternal mental health. And this is the data presented. There's data presented. We learn about emerging programs and interventions designed to meet the gaps in maternal mental health care. And it's also a great networking event. Registration normally costs $155 per person, but PSI Utah will be sponsoring this event, so attendance is free to Utahns. Please visit psiutah.org to register for that. And finally, PSI Utah's annual Climb Out of the Darkness event will be on Saturday, June 24th at Wheeler Farm. This is a free family-friendly event, so we invite everyone to come and encourage moms, families to attend as well. Thank you. Now we're coming over to Dave.
Thank you, Heather. Hi, everyone. My name is Gabe Archuleta, or Gabriela Archuleta. I'm the Public Policy Director at YWCA Utah, and I am also the co-chair of the Maternal Mental Health Policy Committee. And I just want to take a moment to recognize that we are here because of the work that so many people started years ago. Many of them are still working with us on our committees. They are former Representative Rebecca Chavez-Hauk, Representative Jen Daly Provo, and then of course the legislative champions that you heard from today, the survivor moms, the advocates that do not stop, that continue to move this work forward. And I have to say, when thinking about the policies that we talked about last year, and then seeing the improvements that we've already made within 1 year is very inspiring. Last year, one of the areas that we had talked about was needing more screening. Well, because of the funding that advocates were able to put into place several years ago to get more funding for the Utah Department of Health and Human Services to provide provider screenings and trainings for providers, there's now a provider toolkit that's available and out for any provider to use with information in Spanish and English to be able to speak with the people who are being affected by perinatal mood disorders. Policies give us hope. We need to know that things are going to change because we have so many families out there that are struggling. We have so many families out there who don't have access to help and who have no hope. And that is why these policies and the awareness is so important and so critical. And I just want to talk about some of the policies that we are championing. And some of the policies that prior to this year had bureaucratic barriers. So for example, extending postpartum Medicaid to 12 months is absolutely critical. Currently, people who are on Medicaid only have access to coverage for 60 days. For those of you who have birthed a child, think about where you are at day 60. I was barely holding it together. Physically, I was not well, and I was back to work full time. Had I lost coverage at day 60, things would not have gone well for me. So we need that. Right now, people are getting dropped off. And when you have a newborn and you're trying to handle everything else in your life, having to find that care becomes almost impossible, an insurmountable challenge. We don't want to do that to people, but because the federal government has allowed a waiver or a state plan amendment so that we can access this policy, there is hope. And I see this being made an important issue here at the Utah State Legislature, but we need the legislature to pass this. We also need to raise eligibility for pregnancy Medicaid. Currently, a single person can't make more than around $9 an hour. Imagine all of the people that are left out. But thinking of the people that are left out, we think of the Black, Indigenous, people of color, our immigrant communities. Some of the most marginalized communities, and immigrant populations in particular, that have often no access to healthcare. And that's where we rely heavily on community-based organizations like Maternal in Utah and the Black Birth Workers Collective. And then sometimes you see really incredible synergy happen when they have vision. They have done so much work in Salt Lake County, but said, we know that there's moms in rural areas. We know that there is maternal desert, but we need help and we need funding. And so they connected with their representative, Representative Lesser, and together they were able to put together the funding request for this mobile maternal visitation program that will go out to rural areas. And they're already doing the work even without funding. They're in Delta right now, and they currently have 12 expectant mothers that they are working with who before had no access, didn't feel comfortable going to the local providers and or couldn't afford it. But yet Comunidad Materna shows up in town, they can speak their language, and they have access to care for the first time. And in some instances, they're seeing people who are very far along in their pregnancies. We also want to support family planning coverage, which is critical. And ultimately what this is allowing people to make informed decisions, to be empowered to make informed decisions for their lives, for their healthcare. So thank you so much, everybody, for coming together, hearing about these policies, talking about this, reducing the stigma, and championing this issue. We will continue to go forward, and every year I expect that we continue to see more progress. Thank you very much.
Well, thank you, Gabe, and the YWCA and the other organizations for helping organize. Thanks to all of our speakers. Our speakers will remain near the dais after this concludes. If anybody has any questions or there's opportunity for media to interview. If you're a member of the public and would like to learn more about any of the policies that we spoke about today, we'll stick around and we can help connect you with the folks you need to connect to as well. But that concludes today's proceedings for Maternal Mental Health Awareness Month. Thank you all very much for coming, and thanks again to our speakers. Thank you.